Hi everyone, I'm your host Neha and you're tuned into Durian Dreaming, the show that brings you extraordinary stories from seemingly ordinary experiences in Indonesia's fast-paced market. Let's dive into today's conversation with another inspiring guest. Today's guest is someone who's truly redefined what it means to bring world-class healthcare to Jakarta. Meet Dr. Stephen Graaff, the man behind Good Practice, a family medicine clinic that's become a go-to spot for both expats and health-conscious Indonesians. Originally from the Netherlands, Dr. Graaff is no stranger to globetrotting. With a medical degree from Amsterdam and years of experience as a family physician in the UK and the Netherlands, he landed in Jakarta, ready to shake up primary care. His clinic stands out for its evidence-based medicine and a commitment to making healthcare personal, preventive, and top-notch. We are diving into his journey from Europe to the hustle and bustle of Jakarta, the challenges of building trust in a new country, and why he believes family medicine is the backbone of better health. So stick around and you are going to love this one. Welcome to the podcast, Dr. Graaff. We are very excited to have you with us.
Thank you, Neha.
So, Dr. Graaff, what brought you to Jakarta? Was it a calculated career move or did life just surprise you?
Well, how long have you got? This is a long story, but I'll try to make it short and sweet. So basically, I have a long-term relationship with Indonesia. So I visited Indonesia a number of times during my childhood. And this is because my grandmother used to live in Bandung. And when I was a student, I did research in Indonesia, and this was for social medicine. I was doing research about knowledge and behavior towards HIV and AIDS in the early 90s of the previous century.
Oh, wow.
Yeah.
Okay.
At that time, because I had to do this research and do lots of interviews with students, with medical personnel, with a lot of key figures who were dealing with AIDS and HIV, I had to learn Bahasa Indonesia, and which I did in the Netherlands. At that time, it was still possible to study Indonesian at Leiden University. So I was able to conduct these interviews in Bahasa Indonesia.
Okay.
At a later point during my studies, I decided, that I wanted to become a gynecologist. And I thought it would be good to expose myself to a lot of obstetrics and gynecology conditions that are present in Indonesia. So I did my internship for obstetrics and gynecology in the Netherlands, but I also did it in Indonesia, in Jakarta, at the University of Indonesia. And again, I felt really happy during that time, and I felt that Indonesia was a country with lots of challenges. So I really started to appreciate working in a tropical country. So
Okay.
that was... Yeah, that triggered my interest in possibly going to Indonesia for the rest of my career. But at that time, I didn't know that Indonesia was actually a closed market. It's a difficult market to enter as a medical professional because medical professionals are not allowed to practice in Indonesia.
Okay.
So that was... a difficulty I came across at a later stage in life. I met my current wife in the Netherlands, but she is Indonesian, right? And she studied in the Netherlands, and we were both like dreaming about a future in Indonesia. And we're talking, about the year 2000. And I had information from many people here that Indonesia would actually open up its doors to professionals. even medical professionals. And they said that this would all start with opening this up in ASEAN, the Association of Southeast Asian Nations. So this is about 25 years ago. So obviously I had some hope that things were
Yeah.
going to change in Indonesia. So I tried to pursue a career in gynecology in the Netherlands because my idea was, okay, as soon as I become a gynecologist, Indonesia will welcome me with open arms. Well, but this wasn't really true. And I started to realize that it is a very, very difficult market to get into if you're not an Indonesian or if you don't have Indonesian qualifications. So after
Right.
2.5 years, I decided, okay, gynecology is not really my future. And I started to develop a serious interest in general practice, for which I chose to do my postgraduate training in the United Kingdom because I liked the international aspect of studying in the United Kingdom.
Sounds like you've had quite a journey trying to make your dream of working in Indonesia. But you've also worked in Netherlands, the UK, and now Indonesia. So what was the biggest cultural shock in each of these places?
Okay, well, I studied in Amsterdam, which I think was a very good place to study. And I also worked in the Netherlands, among others in Rotterdam. And when I moved to the UK, I felt that the UK was not as progressive as the Netherlands. So topics that we were used to discuss openly in the Netherlands were not so easy to discuss in the UK.
That's interesting. Could you share some specific examples of the topics that were easier to discuss in the Netherlands but felt more challenging in the UK?
Well, for instance, in the Netherlands, it was quite um, normal for me to see, for instance, couples of the same sex. And I felt that in the UK, again, we're talking early 2000, it wasn't as easy to discuss that topic or to ask about it. While when I was in Amsterdam, I always had to ask, according to my teachers, like, okay, is your partner male or female, for instance? And this was a question I couldn't openly ask in the UK at that time. But also things like how a post office works or how a bank works. I felt that in the UK it was all far more traditional than it was in the Netherlands. Also, the way how they address doctors in the United Kingdom was far more formal and with more respect than I was used to in the Netherlands.
Oh, really? And how is that compared to Indonesia?
Well, in Indonesia, I think everyone, even people who I am relatively close with, still call me doctor, I've gotten used to that, but it's a bit of a change compared to the Netherlands, where everyone calls you by your first name. And Indonesia, I mean, in a way, it's nowhere near as progressive as the Netherlands. So that is a big change. On the other hand, people, they are curious, right? They want to speak to you. They want to talk to you. They find you mostly interesting, right? And most Indonesians are like very friendly and they like to connect with you, which I find was also different compared to how I was treated in the United Kingdom. I've been invited to so many houses and for so many meals in Indonesia, and this was very rare in the United Kingdom. And whenever I was invited, it was usually by a couple, of which one of them was actually from abroad, so not from the UK.
And then what's the story behind starting good practice in Jakarta? Was it like an aha moment or was it like a slow build?
Well, actually, I started working in Indonesia because I was offered a job as an expat medical advisor to a big international assistance company.
Okay.
So I didn't actually come to Indonesia because I thought that was like a very suitable or very nice job for me. It was more because of the location. I was offered a job as an international hire at a company, and I thought, okay, this is the location is Jakarta. And I always said, okay, I want to work in Indonesia, and this is my chance, right?
Hmm.
I've now learned that it is very important that you like your job. And it's not just about the location. That's just not enough. So when my contract ended, I thought, okay, I can go back to the Netherlands and be a GP, a general practitioner. Or shall I do something that is a bit more challenging? I thought, well, Indonesia doesn't really have a GP as I know it. They don't have family doctors. And where do all these foreigners who live in Jakarta, and there are, you know, 10,000s, there may be like 79,000 foreigners who live in Jakarta. Where do they go to if they need medical care? And I thought, okay, I have a pretty good understanding about primary care or a family physician's role. I should set up something like that in Jakarta. And to make it easier for the patients, I thought it would be good if there's a pharmacy on site because of the
Okay.
horrendous traffic, as well as an observation room where they could spend a few hours and a lab. So just make it a one-stop place.
And when you thought of starting good practice, what was the most unexpected thing about starting a business in Indonesia?
Well, it was, of course, an awkward situation because I knew that I wasn't able to practice as a doctor. So, from being a traditional doctor, I had to transform myself into an entrepreneur. And this was a challenge, right? I really had to make sure that I was capable of managing and setting up a business, so to speak. And yeah, I think I started to work on getting all the licenses, and which was quite a hard job. It took me like 1 year full time to organize 11 different licenses that were required to open this clinic.
Wow. And along with it, did you ever have to navigate bureaucracy and thought, why did I choose to do this again?
Many times.
Okay.
And then I would talk to my family and friends in the Netherlands,
Yeah.
and they said, well, you're facing these obstacles, but any competition of yours will also face these obstacles. And I thought, yeah, that's true. Everyone who wants to open a clinic in Indonesia has to go through the same procedures. So all I have to focus on is, okay, I want to open this place. So I might as well do everything what I'm required to do. And in the end, there will be light at the end of the tunnel, and I will be able to establish this.
So, because some people also say that Jakarta's healthcare system favors the wealthy. What's your take on that?
I think, well, I've seen Indonesia, especially Jakarta, has
Yeah.
developed enormously, right? And there are lots of people who have a lot of money. And I think health is and will be one of the most important things that people are trying to achieve. Everyone wants to have good health. As we can see, it's about over 1 million medical visits to other countries in the region to try and get the best possible health care available. My point is that, of course, in Jakarta, people want to have part of that, a slice of the cake, so to speak. They know that people are actually looking for the best possible health care, and they're trying to provide that locally. it doesn't really it favors the more wealthy people. On the other hand, it also helps the more basic health facilities because everyone will try their best to become better. And it is, I mean, it's not ideal, but healthcare in Indonesia is slowly getting better. And I think that's because there's more competition and more people are aware that people find it so important to have good health. So they're really willing to search for this anywhere, which can be even outside Jakarta.
And what's been the most frustrating part of working in Jakarta's healthcare scene?
I was used to work with people in the hospital, and I was used to work with a lot of colleagues who would, I think, support me to provide the best possible care for our patients. I feel that in Indonesia, it is a little bit more difficult to establish a good relationship with medical specialists in hospitals to work together to improve the condition of our patients. There is, I mean, in the Netherlands, it's quite normal that as a GP, you have good connections with the local hospitals.
Right.
And the specialist would be very willing to help out. They wouldn't mind if the GP calls them. If they wouldn't mind educating them, and they wouldn't mind any good cooperation. And I feel that is a bit less here. It's not as common.
That's interesting, Dr. Graaff. Do some of these challenges might be because you're a foreigner? I mean, have there been moments where you felt that being too foreign made it harder to understand the needs of Indonesian patients fully or to collaborate effectively with local hospitals?
No, I think most Indonesian doctors in hospitals are quite friendly to foreigners, but most of the cooperations are between my Indonesian doctors and the Indonesian specialists in the hospitals. So it's I find that they are struggling because most hospital doctors they don't think very highly of primary care physicians, which is a shame.
Hmm. And what's been the most surprising thing you've learned about healthcare in Indonesia?
Well, I know that I live and work in Jakarta, and I think this is the national center of medical excellence.
Okay.
But still, I find that some doctors or facilities do not practice medicine the way we do in our good practice clinic. It means that I'm sometimes surprised, like, oh, how people can come to certain decisions.
Mm-hmm.
And I wish that there was more of an open dialogue possible, like, to find out the reasoning behind certain actions. And that is what I miss. I felt that in the Netherlands or the UK, if I would confront or ask a colleague in the hospital to explain why certain conditions were treated in a specific way, I would get like a very good answer, an answer that I would understand. And here, that is more difficult to obtain that answer.
Yeah, I see what you're saying, Dr. Stephen. Do you think Indonesia is ready for world-class healthcare, or are we still stuck with band-aid solutions?
I think Indonesia wants world-class healthcare, and it's a goal. And unfortunately, sometimes we are still stuck at the level of only giving the basics, and even the basics is it tends to be provided in a different way because it varies from the facilities. So we cannot say that hospital A or hospital B or clinic C will act in the same way to handle certain conditions. And that I find disappointing. I feel that, if you know about the evidence that is available, or if you know what sort of guidelines are known to treat certain conditions, it would be more standardized, the level of care. And I think the level of care would be better if we all implement and use the evidence that is available nowadays.
With that in mind, what's one thing you think Indonesian healthcare professionals could learn from Europe? And what's one thing Europe could learn from Indonesia?
I think what Indonesia could learn from Europe is that a good primary care system, meaning that you train good general practitioners, that will help healthcare enormously. There's already so much proof that if you invest in primary care, it will increase, for instance, your life expectancy. And if you provide and invest in primary care, chances are that it will actually help the care in the hospital, because people will have less desire to go to a hospital, and they have less desire to take up the time of the already limited amount of specialists. But you need to be a good general practitioner to make sure that you keep those people away from the hospital. You need to be aware of all the evidence that is available. You need to give good arguments to patients and explain in detail why you're doing certain things, so that they can trust you and that they can see like, oh, actually the general practitioner is all I need, because he or she has sufficient knowledge to treat me or manage my condition. And that is really important. I believe that there is a role for good primary care in Indonesia. And that's something that Indonesia can learn from, for instance, Europe or the United Kingdom.
Okay. Family medicine is all about relationships.
Yeah.
So how do you connect with patients from such diverse backgrounds?
Well, I have to say that I'm very blessed to work with people from a lot of countries. In good practice, we have registered patients from 80 different countries. And I find it very interesting to meet them. But even, a simple question like, so where are you from? And how long have you been in Jakarta? And how do you feel about living here? It gives me so much joy.
Yeah.
And also the role that we have in making them feel at home in Jakarta, because it's not only medical questions, right? You have people who come in and say, well, I like it here, but I don't know where I should buy my meat or my groceries. And you can advise them. or even about, school or after school activities for kids.
Yeah.
Because at the end of the day, I've been living here now for 13 years, 13. And I've started to get to know Jakarta quite well. So I love discussing daily life and options that are available to all of us here in Jakarta.
And what's the weirdest question a patient has ever asked you? I mean, of course, without taking names.
Well, I find it funny when people ask me like, oh, so Dr. Steven, so when are you packing up and going back to Europe? And I think, well, I'm pretty happy here, and I run a clinic, and I don't want to go back. So, and that usually those questions are asked by expats who are returning or moving to other countries.
So, Dr. Graaff, have you ever been tempted to throw in the towel and move back to Europe?
No, I feel that there are plenty of challenges in Indonesia,
Yeah.
and I really love working and living here. I don't want to go back to Europe.
So, be honest, even during a really bad traffic jam, you've never regretted moving here?
No, I don't work. I mean, my house is not too far from my work, so I don't really suffer uh, from any traffic congestions. Um, and I really appreciate life in Indonesia very, very much. So I don't want to go anywhere. And when you asked me about the difference between healthcare in, for instance, Europe and Indonesia,
Yeah.
sometimes you can organize things quicker in Indonesia. So let's say, if you want a certain scan or an X-ray or
Mm.
you want some blood tests, etc. It's quite you can organize that fairly quickly if you know the channels and if you have the means, and that is a big difference.
Okay. And what's that one thing that Indonesia does better than any other country you've lived in?
Um, well, I think it's that the people are quite are friendly, right? And they can smile. They're less grumpy. They are polite, and that is. I mean, in the UK, people were also polite, but they were more reserved. And I find Indonesians are more inviting than the people I used to work with in the Netherlands or in the United Kingdom.
Okay. Dr. Graf, Indonesians have all kinds of herbal remedies. Have you ever been tempted to try any?
No, it's all about evidence-based medicine.
Okay.
So, yeah, no, I have not. I've not been tempted.
Okay. Between all the nasi goreng and sambal, do you ever worry about the doctor's diet going out of the window?
Um, no, I guess, the older you become and when you realize that your metabolism slows down,
Mm.
that you are vulnerable to chronic conditions, you tend to become more careful. Well, at least I become more careful. And you become more aware about what is healthy, what is good, and what's not good.
Okay. What's your go-to food in Jakarta?
Well, I have to say that I like going out for a meal,
Mhm.
but there's this restaurant in Senayan. I guess I cannot name it, but it's a Japanese restaurant, and I went to this restaurant, I think, for the first time in 1997. So that is the previous century, and they're still there, which I think is a good sign, right?
Hmm.
Yeah, if you manage to have a business for over 20 years, it means that you must be doing something right. And I still like going there. I always look forward to go there
Hmm.
and have a meal. And I guess, yeah, most of the staff, they must know me. And they're friendly and they never disappoint me. So yeah, I like that place. Although I try many places, but that specific restaurant in Senayan, yeah, has a special place for me.
Okay. And Dr. Graf, what's your guilty pleasure when you want to escape the stress of running a clinic?
Well, a guilty pleasure. I don't think I will disclose that in this podcast. But at the end of the day, I have many pleasures in my life. It can be spending time with my kids, going out for meals, meeting up with people. At the end of the day, uh, I think it's important that you surround yourself by people who you feel connected with
Hmm.
and trying to have a good balance between work and personal life. I think I manage quite well. Also gives me great pleasure.
Okay. And if you weren't a doctor, what would you be doing right now?
Well, I remember the days when I was studying in Amsterdam, and mostly it's memorizing stuff, right? But you really need to go. At least in my time, I had to memorize books and books and books, and I thought, oh, this is horrible, and I will probably be up late to manage to learn all this. But I also said to myself, I think if I have to live my life over again, I would still go for the same studies because I don't think there is any other profession that interests me as much as medicine.
Okay. And what's been your proudest moment running Good Practice?
Well, Neha, Good Practice is a simple primary care clinic, right? We only have family physicians, but I'm proud that institutions like, for instance, the Asian Development Bank or an embassy or CEOs of companies that can afford any healthcare provider in Jakarta or in the region, but that they decide to come to Good Practice for their medical care. And my clinic doesn't look like a five-star hotel, right? It's not about the hardware, it's about the software. So I feel immensely proud if people still decide to come to us, although, we're not like a five-star hospital, but they still want our opinion. And I'm always proud to say, look, we use common sense combined with evidence-based medicine, and we try to be as friendly as possible. And of course, we do our best to understand everyone. So we're continuously improving our English, and we try to be as accessible as possible. And that makes me happy, basically.
And if you could change one thing about Indonesians' approach to health, what would it be?
I think my approach would be, try to have faith in your primary care doctors because they should be your first port of call. And if they're good, they can handle most of the cases. I think 85% should be handled in primary care. You don't need a hospital. You just need a good family physician.
Okay. Dr. Graaff, what advice would you give to other foreigners thinking of starting a business here in Indonesia?
Okay. Well, first of all, you have to have a vision. Like, what do you want to accomplish? And you need to be adamant to achieve your goal or your target. I would also say it's very good if you learn the language. In the year that I had to sort out all the licenses for my clinic, I made all of the contacts myself, right? And I found that lots of the government officials were very helpful as soon as they knew that you can speak Bahasa Indonesia, because it also shows that you have an interest in Indonesia,
right,
and that you are serious to do business here. And yeah, I think that is important. So language is important.
Yeah, thank you, Dr. Graaff. That's a very, very helpful advice. So if you had to describe your journey in Indonesia in 3 words, what would they be?
Okay. I think the first word would be vision.
Okay.
The second word is persevere. And the third word would be enjoy. So vision, persevere, and enjoy.
Okay. Interesting. Lastly, what's next for Dr. Stephen Graaff? Any big plans or dreams for the future?
Well, because Good Practice basically has a lot of foreign patients. I think maybe 95% of my clientele is foreign. And maybe it would be good to open a branch, especially in Bali, because Bali there has a lot of travelers, but also a lot of long-term expats who live there. And I think there is a need for a reliable clinic where they can go to with any condition.
Okay.
So yeah, a branch in Bali would be one of my future ideas.
So is it this year that we look forward to a good practice clinic in Bali?
No, I don't think it's this year, but it's somewhere in my mind. Yeah.
All right. All the best for that, Dr. Graaff. Is there any quote you want to leave our viewers, our listeners with? Any of your favorite quotes or any philosophy that you live by?
Right. Well, Neha, I feel that when you aspire to open a business in Indonesia, you have to have like a long breath. So there is a lot of preparations that are needed. So it's not only about getting the licenses, getting the money, etc., but it's also you have to learn about Indonesian culture, which is so complicated, right? Because there are many ethnic groups, many different languages, and then we live in Jakarta, which is like a mix of all these different groups. And all of them, they have different religions, etc. But I think you should do a little bit of your homework about how Indonesia has developed itself from independence until now. And even the period before independence is very interesting. Maybe because I'm Dutch, I really like to learn, to read, and to get myself more informed about the colonial history of Indonesia. It has my interest as well. So I think you should have you should demonstrate a genuine interest in Indonesia. Then you should demonstrate that you're willing to learn, right? For instance, you learn the language, and you have to have that vision. Like, okay, like for me, it was I want to put a clinic in Jakarta that attracts foreigners.
Right.
And I know that is a bit restricted, but on the other hand, I think there are like over 70,000 foreigners in Jakarta. So the number of people that actually go to good practice is just a tiny bit, a tiny slice of that big cake. But people, I thought you start with a tiny slice, a small percentage of those foreigners. But in the end, word will spread and people will think like, oh, this is a place to go to because I have a very clear target, right? I have a very clear target. It's for foreigners. And in the end, if Indonesians see like, oh, foreigners like this place, they will also come. And we see an increase in Indonesian patients too, for which I'm very, very grateful. And you have to be unique, right? You have to be different than others. Because otherwise, if you're just the same or just as good, people don't need to come and see you. You need to be unique. You need to have an extra different aspect that makes you attractive. So I always try like, okay, being like another clinic is not enough. I can give you an example that I like to go out into the community. I do lots of talks, health talks, for instance, right? And maybe Indonesian clinics do health talks too, but we do it in English, right? It's again a little bit different. Or, you do a health talk about a topic that is, people are interested in, but not a lot of people provide health talks about that topic. And be, again, accessible. I always say to companies, to schools, to embassies, try us. Yeah? If you think of a topic, we will work on it and we will come. And we do it in an interactive way, right? And for us, it's also it's not only a challenge, but it's also nice because it breaks the normal routine, which I think that is one other aspect, right? That the variety of jobs. Yeah, I'm an entrepreneur, but I can also be a speaker, or I have to maintain relationships with groups within Jakarta, and that makes it, I think, very attractive for me. So, yeah.
Thank you, Dr. Stephen. Very, very profound and beautifully summed up. And thank you so much for a very candid conversation with us. Very interesting journey, and good to know that even though it's difficult to actively practice medicine in Indonesia, you've made a big mark for yourself and good practice here in Jakarta. Congratulations on that, and wish you all the best.
Thank you, Nea. Thank you for this enjoyable conversation. Thank you very much.
And that's a wrap for this episode of Durian Dreaming. I hope today's discussion sparked some new ideas for you. Don't forget to subscribe, share your thoughts, and stay tuned for more exciting stories. Until next time, keep dreaming big.